to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. I'm a past member of the International Progressive MS Alliance Scientific Steering Committee, and currently I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. The MS Society's Ask an MS Expert webcast is designed to give us a place for the MS community to connect and to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. Please feel free to post your comments and questions on Facebook, YouTube, or Twitch. MS navigators are online throughout today's program, answering those questions and connecting you to resources. Studies suggest that MS impacts women almost 3 times more than it impacts men. And for some men, having what is typically thought of as a women's disease may increase the challenges associated with diagnosis, acceptance, and treatment adherence. Today, we're joined by Dr. Robert Shin to talk about MS and men, why it's important for men to get that diagnosis, start early treatment, and find support. Dr. Shin is a professor in the Department of Neurology at MedStar Georgetown University Hospital, and he's the director of the Georgetown Multiple Sclerosis and Neuroimmunology Center. Before we get started, I'd like to note that we acknowledge that sex and gender exist on spectrums. In our discussion today, we'll use the terms male or men and female or women to refer to a person's sex assigned at birth. Now I'd like to welcome Dr. Shin, and thanks for joining us today. Early diagnosis and treatment are really key to living your best life with MS and experiencing fewer debilitating symptoms. But research published in the Journal of Neurology makes the case that men can take longer to report symptoms or get evaluated for MS, and they often start treatment later. So Dr. Shin, why is this finding important, and how can early diagnosis impact MS in men?
Well, you touched on it in your introduction. For instance, just the observation that men are less likely to be diagnosed than women. As you said, studies suggest that 3 times as many women as men are diagnosed with MS, raised a lot of questions. And then the observation that men diagnosed with MS seem to have a worse prognosis. They often seem to have more disability or more rapidly convert from relapsing MS to progressive MS. And sometimes just seem to not respond as well to therapies. These observations raise questions, and you've already mentioned that it's been discovered that men might be delayed in terms of being diagnosed with MS. And this delay might be because they're slower to seek medical attention, or perhaps we in the healthcare field are slower to recognize it in men. And all of these factors come together because, again, as you pointed out, what is the one thing that we've learned? One of the most important lessons we've learned over the past decade or two is that early effective treatment of multiple sclerosis makes a humongous difference. So maybe if I circle, I guess, back the other way, I would say if men are less likely to be diagnosed, or their diagnosis is delayed, or they are offered treatments later in their disease course, perhaps this explains why we observe that they in general seem to have a worse prognosis. So anything we can do to fight against those factors, I think could be very meaningful.
Well, as you well know, part of the tricky part here is that the first symptoms of MS can be vague and they're often easy to dismiss. What are some of the symptoms that men should be aware of, symptoms that could be possible indicators of MS, and when is the right time for them to talk to their doctor?
Well, it's difficult to single out just a few symptoms because, and I think as you well know, people who live with MS can have a variety of different neurological symptoms. Really, since MS affects the brain and spinal cord, anything that the brain and spinal cord controls can be affected by MS. So some early symptoms that are common can be visual symptoms, such as blurring or doubling of vision, sensory symptoms, such as numbness, pins and needles, pain at times, obviously weakness, tripping, stumbling, having trouble with balance, trouble with coordination, maybe even sometimes early bowel and bladder symptoms or issues with sexual function. Cognitive issues we're increasingly recognizing as being common early in MS. So gosh, there's so many symptoms, it's almost what symptoms would you not worry about? But I think we might want to fight against the tendency to maybe, if you will, blow things off. Say, oh, it's nothing, or I'm okay, or the idea of shaking it off. Maybe if we can educate the community that any of these neurological symptoms, blurred vision, numbness and tingling, a little bit of weakness, a little bit of imbalance, should be taken seriously and maybe should be assessed by a physician or neurologist. That would apply to men or women. But I think in the context of today's podcast, obviously we want to make sure that men are getting that message.
We heard from Mark, who tells us he's living with MS. He's in a support group with several women, and he's noticed that the women in support group have very different symptoms than he does. Mark's wondering why that is. You've already begun to touch upon this, and what he really wants to know is whether MS symptoms are different in men than they are in women.
Well, I'm going to tell you my opinion is that MS does not really affect men and women differently. So brain, spinal cord, the symptoms we discussed are going to be present. But I do think there may be a different threshold for recognizing that something is significant. And there may be, if you will, gender role or stereotypes that result in men maybe ignoring certain symptoms. So I'll give you a great example, which would be just numbness and tingling. So I have many of my patients who may have noticed a little bit of numbness and tingling, and they said, I should get this checked out. I need to find out what's going on. And I'm going to stereotype and say maybe women may be more comfortable doing that. Whereas there may be a situation where men would just shake it off, or I'm fine, or I'm macho. I'm not going to pay attention to that. It's no big deal. As a result, what we may see is that when men are diagnosed with MS, or when they've sought medical, it's for, if you will, more dramatic symptoms. Perhaps they finally went to a doctor when they started dragging their leg. They were having trouble walking, and they sought medical attention. Maybe it's because they had very dramatic double vision and they really couldn't ignore that, for example. So if you put men and women into a group and they're sharing their experiences, it may appear that men have different symptoms than women. I would argue perhaps that's really an artifact of the fact that men may be missing or have neglected some of the earlier signs of the disease.
Well, this may relate to something you just said. I was going to ask you not so much about symptoms now, but about disease course itself. Does MS progress differently in men than it does in women?
Right. Well, I might have mentioned this in passing, but there has been the observation, for instance, that men are more likely to be diagnosed with a progressive form of MS, including primary progressive MS. It's been observed that the time of conversion from relapsing MS to progressive MS may be shorter in men than in women. And it's been observed that just overall, if you look at the amount of disability, that men seem to end up with more disability than women. Now, one possibility would be that there's a sex difference, that men and women, for some hormonal reason, are different. But as we discussed earlier, my concern would be that what if these observations are really just a result of delay in diagnosis? For instance, you mentioned at the very top of this podcast that men are 3 times as likely as women to be diagnosed with MS. It's interesting because when we started to first look at this, the first statistic was really that the ratio of women to men was more like 1.5 women for every man. And then later, studies suggested that it seemed like there were twice as many women as men being. And now recently, as you pointed out, it seems like 3 times as many women as men are diagnosed. So one question would be, well, why does this ratio seem to be shifting? And of course, there could be, I guess you could hypothesize some sort of change in biology over the past 40 or 50 years that we've been looking. But I would also say the other thing that's different is we keep talking about multiple sclerosis as a disease of women. That's almost the first thing we say is multiple sclerosis. We've often said primarily affects white women. Now, I know that you've done a lot of good work in bringing light to the fact that actually Black and white Americans are equally likely to be diagnosed with MS, or maybe African-American women, maybe more, so you're doing a lot to fight that, if you will, misinformation that it's primarily a white disease. I would argue we should do the same for the, if you will, I would argue point that MS primarily affects women. I would say that we should stop saying that. Whether technically true or not, I think the only thing emphasizing that does is lead us to underdiagnose it in men. Or as you pointed out, for men to say, wait, how do I have MS? I thought it was a woman's disease, as you pointed out. You said something, I think maybe that women are 3 times more impacted. Men and women are impacted by MS regardless. But I would use the analogy of, let's say, heart attacks, if I could go to a different medical condition, because I don't know if your listeners know this, but 3 times as many men as women are diagnosed with heart attacks. But we have observed that when a woman has a heart attack, her outcome is worse. She's more likely to die of a heart attack than a man. And we realize, what's happening is we are underdiagnosing heart attacks in women because we just stereotype that it's a man who would have one. And so there's been a lot of effort to teach people about the signs of heart attack: chest pain, dizziness, arm pain, fatigue. And we don't emphasize men and women. We just, hey, if you're a human being and you have these symptoms, get attention right away. And I feel like we should do the same. In MS, we keep emphasizing MS affects women more than men, but men have a worse outcome when they have MS. Well, what if this is all just because we're emphasizing the wrong message? What if we could emphasize the symptoms, the neurological symptoms like dizziness or numbness or vision loss, weakness, whether you're a man or a woman, pay attention to those symptoms and get attention. If the sex ratio is a little bit different, why does that even matter? That shouldn't really be an emphasis.
Do we know whether MS reduces testosterone levels or whether decreased testosterone levels play any sort of a role in causing MS or impacting its symptoms or disease progression in men?
Well, it's a great question. The impact of hormones, whether testosterone or estrogen, has been examined and looked at because of the observed sex differences that we're talking about. My take on the data is that we don't have definitive evidence that MS raises or lowers testosterone. It's a little bit tricky because, for instance, low testosterone in men is probably actually underdiagnosed. And the symptoms of low testosterone can include things like fatigue and some type of cognitive impairment, which can, for let's say a man living with MS, how do you know whether it's MS or maybe a hormonal issue? And I think that really confounds the issue. But my opinion is that we don't have definitive evidence that multiple sclerosis impacts hormone levels or is clearly impacted itself by hormone levels.
Which factors should men and their doctors consider in selecting an MS disease-modifying medication?
Oh, well, this is certainly a tricky question. And again, I would tie this back to maybe observations when we look at race in multiple sclerosis. For example, it's been observed that members of certain racial or ethnic minorities in the US who have MS have a worse prognosis, which might make you think, hey, maybe we should pay more attention to that and maybe offer highly effective therapy. The irony, at least in the US, is that the very same minority populations that we've recognized have a worse prognosis are often offered less effective therapies or don't have access to the more effective therapies that have been developed over time. Now, when I translate that into looking at men, for example, we've sort of said over and over again, men seem to have a worse prognosis when they're diagnosed with multiple sclerosis. One might argue, should we be using different therapies if you're a man or if you're a woman? I'm not so sure I would translate the observations in that way. For instance, I would be more interested in why do men seem to have a worse prognosis? Why do they have more progressive MS? If it's because of a delay in diagnosis, then or if that contributes to it, then I would say that's where we should put our attention. Earlier, accurate diagnosis in men. But once a man has been diagnosed with MS, I'm more of an advocate for look at that individual person. If they do have a lot of pre-existing disability, if they have a high burden of, let's say, spinal cord disease on their MRI, those factors may push me to offer a more highly effective therapy earlier. But I'm going to say not because you're a man. I would say, but it would be because of your unique situation. So I just personally would be reluctant to make a generalization. But I think that that emphasis of saying, but look at this individual with MS, what is their situation? Should we be opting for a highly effective therapy earlier? That's going to be an individual decision.
Effectively managing MS means more than just addressing physical wellness. When you're living with a chronic health condition, it's important to manage stress, pay attention to your mood, and build and nurture relationships. What kinds of interventions would be helpful in addressing these kinds of issues? And what's the best way to approach some of those conversations that men aren't always great at having?
Well, how interesting that as soon as you mentioned each of those factors that are very important for wellness, just in today's culture, they seem like female issues. They seem like things that we don't traditionally include for men, just in these gender roles. Stress management, be a man, like man up, or just handle it is really the way our culture approaches things. Paying attention to mood. Again, often when we're talking about being sensitive or talking about feelings, we culturally perceive this to be more of a feminine approach. Building relationships, really that's about also being open, communicative, and being willing to ask for help. All things that, again, stereotypically we associate more with women than men, unfortunately. So I think that given the evidence that these factors are important, we do have to maybe make a little bit more effort for people living with MS who are men in opening up those doors or encouraging them to do things like pay attention to their emotional health, be willing to ask for help, be willing to be a part of something with a support network. So I think you're bringing attention to these factors in the management of multiple sclerosis might help to offset maybe some of these pre-existing gender stereotypes that honestly we live with every day.
Well, while we're talking about mood, depression is very common among people who are living with MS. Do we know whether the incidence for depression among the MS population is greater for men than it is for women?
Well, interestingly, I have to be honest, I don't know, maybe you've already done a podcast on this subject, but mental health is so important in multiple sclerosis. In fact, anxiety and depression are present in more than half of individuals living with MS, according to some studies, and it's just really underappreciated and underaddressed, whether you're a man or a woman. Now, the reality is, MS aside, depression is diagnosed more frequently in women than actually, interestingly, the studies would suggest that women are 1.5 to 3 times as likely to be diagnosed with depression as men. It's almost the exact same statistic as MS. But part of this, again, I think is confounded by this. Women are more likely to be diagnosed with depression. Isn't necessarily the same thing as saying that women have more depression or are more likely to have it than men. There could be the same bias, under recognition in a group, which, as we just mentioned, might be reluctant to talk about their feelings, or we as healthcare providers may not be as comfortable even broaching the subject. So it's hard for me to make a general statement. Again, I think I should be, the healthcare field, we should be vigilant for symptoms of mild depression or anxiety in all of our patients. This could be, by the way, it doesn't have to be sadness and crying. It could be fatigue, disturbance of sleep, low energy, decreased sex drive, decreased appetite. All of these symptoms could be part of, could just be part of MS, but also perhaps are related to MS associated depression or anxiety. And so being vigilant for men and women, I think, is very important.
We heard from Dennis, and he's experiencing sexual dysfunction, making it difficult for him to be physically intimate with his wife. Now, Dennis wants to know if this is something that's directly caused by his MS, Could it be caused by his MS medications? And more importantly, Dennis wants to know what he can do about it.
Right. Very important questions. And this brings up a subject that often people may be not comfortable talking about. Hopefully, people living with MS will have a good relationship with their healthcare providers where they can confide this sort of information. Now, we already mentioned that some types of symptoms can be associated with MS-related issues like some mild depression. For instance, decreased sex drive, decreased energy is going to affect your sexual health. Now, these things may be more secondary to a little bit of mood disorder, which maybe could be addressed in that way, whether with medication in some cases or things like cognitive behavioral therapy or counseling, for example. However, multiple sclerosis does affect the central nervous system. It affects the brain and spinal cord, and therefore MS can directly affect things like certainly urinary function, as we well know, but also sexual function. And this is for men and women. If we're honest, often in the, sexual function side, people think about erectile dysfunction for men, which absolutely can be affected directly by multiple sclerosis or indirectly by decreased libido. But let's not forget that there can be sexual symptoms for women as well for the very same reason, due to decreased sensation and decreased functioning. Now, as to what to do with it, once recognized, really the key is to get to the root of it. Again, if it's energy level, if it's mild depression, then obviously we need to address that. There are options for addressing, if you will, more functional sexual symptoms. And in that case, I usually refer my patients to a urologist or urogynecologist for women to address those symptoms. So it's very good that you brought this up because, again, sometimes in our culture, we're hesitant to speak about it, but it's so important from a quality of life standpoint. Intimacy is so important in any relationship. And also letting people know that there might be some options. There might be ways we can improve this, just by being open about it. So I appreciate your bringing this up.
And maybe as a follow-up, does MS impact a man's ability to have children? And are there any medications men should avoid while trying to conceive with their partners?
Well, very interesting. I would say that, to my knowledge, there is no direct impact on fertility from having multiple sclerosis. Now, I've had many men and women living with MS who had concerns about things like, why will I give MS to my children and things like that, where I usually I say, no, we don't directly pass on MS to our children in any way. And so they shouldn't certainly be worried about it in that regard, in my opinion. But I guess I would also reassure them that having multiple sclerosis, to my observation, does not impact fertility. Obviously, the other issues we were just addressing in terms of libido and sexual functioning, we would want to address that, but fertility shouldn't be different. As far as medications or disease-modifying therapies to avoid, there are now so many different MS disease-modifying therapies. One should be careful about generalization, but I'm going to generalize and say that there really isn't a humongous difference or in my opinion, concerns with different medications affecting things like fertility in men or women for that matter. Now, having said that, individual MS disease modifying therapies may have specific guidelines in terms of, conceiving on or off the medication, or in terms of washout, if you will. So that will be specific to individual medications. But as a general statement, no. Being a man doesn't mean that you're going to have different treatment options than a woman over some sort of fertility concern.
Well, thank you for helping us better understand some of the different ways that MS impacts men, as well as some of the things that men should be aware of in managing their MS. Let me ask you, what would you say are the top 3 takeaways that you'd like our viewers to remember today?
Ooh, top 3 takeaways. Well, one, as I maybe sermonized a little bit earlier, we need to stop talking about multiple sclerosis as a disease that primarily affects women. Whether statistically true or not, MS affects people, whether you're a man or a woman. So secondly, I would say we need to educate men and women, but men in particular, about potential symptoms that should be addressed or investigated, like numbness and blurred vision and weakness and dizziness. And also encourage each other to seek medical attention if someone were to share that they're experiencing a symptom. And then really, I guess, last but not least, would be emphasizing what you brought up at the beginning. The key to fighting this disease for anyone really is early accurate diagnosis and early treatment with a highly effective disease-modifying therapy. And so I guess indirectly with points 1 and 2, if we're able to diagnose MS in men accurately and earlier and get them on an effective therapy, I think we're going to be able to make a tremendous amount of impact.
Well, thank you for sharing your expertise again on these topics. I think we have time for another question. We heard from Joanna, whose husband has MS, and Joanna wants to know whether having MS impacts her husband's life expectancy.
Oh, well, when I first started learning about MS, this was in the era before there were any disease-modifying therapies, if you can believe that. MS was a not treatable disorder. And I was taught that MS did shorten life expectancy a little bit because if somebody had a tremendous amount of disability, which was common back in those days, they would be susceptible to things like pneumonia and bladder infections and things like that. Today, I actually don't, I basically say that MS does not affect life expectancy for men or women. And this is partially a reflection of our ability to better treat and control this disease early on. So I would just say MS does not affect life expectancy. Now, I will kind of comment that it has been observed that women live longer than men. And I guess Joanna's married to her husband. There's sort of a funny irony. There was some data that suggested that when men and women get married, men's life expectancy increases, but women's decreases a little bit. So I don't know what men are doing to their spouses that would do this. But in general, although technically, statistically true that men have a shorter life expectancy than women, just for all human beings, multiple sclerosis does not affect that.
Well, I want to thank everyone who submitted some great questions, and thank you for being with us today, Dr. Shin.
Oh, such a pleasure to be with you. Thank you so much.
Before we close, I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. For information and resources on multiple sclerosis, please visit the Society's website. You'll find research updates and news, information on connection programs like self-help groups and MS Friends. You'll find ways to get involved, and you'll hear about upcoming events that are taking place near you. Remember, you can connect with the National MS Society and others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. And I hope you'll join me every week on the Real Talk MS podcast, where I continue the conversation that we start here. You'll find Real Talk MS at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, or wherever you find your favorite podcasts. I'd like to thank Dr. Shin for joining us today. Please remember that a recording of this webcast will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us at this same time for next week's edition of Ask an MS Expert. You can always find our upcoming program topics on the National MS Society's website. And now I have a favor to ask each of you. Getting your feedback on today's webcast is important. So if you're watching on Facebook Live, you'll see a link to a survey pinned to the comments section. And on YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute to fill it out. On behalf of Dr. Robert Shin and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.